Değerli konuklarımız,
Esteemed guests, welcome again. Today, we are together in a very important panel. We will talk about the resilience of the healthcare systems, and discussion on the environmental issues will be the subject. We will have 4 valuable speakers. One of them will be with us on an online basis, and 2 of them are physically with us. I will present and invite the 3 speakers now to the rostrum, please. Dear guests, of course, delegation of the European Union to Turkey, European Health Alliance representatives, and all the partners playing an active role on the project, I would like to respectfully thank each and every one of them. Today's topic is climate change in Turkey and how to establish disaster-resilient healthcare systems. As you know, in the recent years, healthcare systems became an important topic in all the healthcare issues, especially in terms of policy development. They play an important role. Of course, there are certain aspects related to that, and one of them is that, as we have witnessed in the pandemic, communicable diseases, when they occur in a country, they can disseminate to all the world, and they can impact millions of people. And another aspect is that the environmental issues, global warming, climate change, and within this context, they impact the lives of millions of people. And in line with that, of course, our health deteriorates. For the development of healthcare systems, there are certain issues to be taken into consideration, especially World Health Organization. As you know, the resilience concept has been on the agenda of this, especially in the last year. It was quite mentioned, and it was a hot topic. And as it will be further discussed by my colleagues as well, so the healthcare system should be ready for such crises. They should have early response mechanisms. And when coping with crisis and adapting to the crisis and transforming and learning lessons and making a progress are the hot topics of this issue. So I will just say one more thing, and I'll leave the floor to our panelists. The healthcare system has more than one component, like management, finance, provision of services, environmental and universal coverage, and one of them is the most important one, maybe the human resources, because without the human input, a system cannot prevail and cannot succeed. So all the systems should invest to human resources. So maybe the most important topic of today's discussion is that we are investing to the human resources currently, and the representatives of NGOs, public institutions, and professionals, healthcare professionals, the better they know about the importance, I'm sure that the more resilient the healthcare systems will be, and also environment and climate change issues will be able to be handled in a better manner. So, among today's speakers, we have Shweta Narayan. As we don't have her presence with us, we will proceed with the other speakers in the order which is mentioned in the agenda. Ms. Çiğdem Fevzi, Mr. Fevzi, and Ms. Melike Yavuz will be with us. Ms. Çiğdem Çağlayan will talk about why a healthcare system resilient to climate and disasters is necessary. She is from Kocaeli University, Public Health Department. She is a lecturer and academic. She is also one of the partners of this project, and also the university is a partner of this project. They were actively playing a role. So let's start with Ms. Çiğdem. I will use the rostrum if you allow me. By the way, we have until 12:30, so each speaker have 20 minutes allocated to them. So please, let's try to stick to the time allocated so that we can have time for Q&A session. Well, I'm a bit weirdly excited, so please accept my apologies in advance if I have any mishaps. I'm quite excited, and this is an important topic that we will be discussing. My presentation consists of three main topics. I will first start with main concepts and definitions so that we understand each other better. Then I will talk about, which is also the topic of my title of my presentation, why do we need such a system which is resilient to the climate and disaster? And I will talk about the rationale behind it. And if I have time, I will try to elaborate a framework of the activity. So I will talk about the concepts of climate adaptation and resilience, disaster risk management, mitigation. In the recent Kahramanmaraş earthquake that we have witnessed once again that the disasters are an important part of our country, so we comprise both of them. The healthcare system is resilient to climate and also disasters, so how to work on this issue. Climate adaptation, which is highly debated, it is from time to time debated with the climate resilience. There are certain differences. Climate adaptation is the real or expected climate and adaptation to its impacts. When we talk about human systems, adaptation has the aim of first mitigating the damage and also, if any, taking an advantage of the opportunities. Again, the climate change can be short-term and long-term in terms of its planning. In the short term, especially the disaster risk and the mitigation of such risk, emergency response, and the management of communicable diseases. So urgent response and threats are handled, and for long-term climate and environmental issues and the risk imposed by them and definition of their tendencies and making the necessary planning are the relatively long-term activities. When we talk about resilience, in general, when we talk about climate resilience, it is the capacity of a system to handle with a dangerous incident while also maintaining its capacity to adapt, to learn and transform and to respond to the crisis. So, which means that a system should be flexible and should transform based on the circumstances, and when still functioning under stress, it should maintain its holistic agility and capacities. Disaster, which is another topic of our discussion. I think everybody knows this definition, especially in the impacted society. By using its own resources, it is above its capacity to cope with the incident, which also involves human resources, material and non-material loss and damages. So, mitigation of the disaster risk, definition of the risk, evaluating and mitigating. And we talk about a systematic approach, especially while doing that, the vulnerabilities in the society and the mitigation of the disaster risk should be the purpose. When we talk about mitigation of the disaster risk, we are talking about the climate and volcanoes, earthquakes, which are non-climate risks and dangers. Climate resilient healthcare systems are defined by the WHO as, despite an unstable climate, in order to provide continuous improvements estimating climate-related shocks and stresses, replying to them, responding to them, and ensuring the recovery from this incident. So, if we can wrap up all the characteristics of this definition, a healthcare system resilient to disasters and climate, we have the characteristics of such a system, actually. So, identifying, monitoring, forecasting, communicating, and preparing for the healthcare risks related to disasters, responding, managing to the uncertainties, carrying out operation for risks, and with minimum external support, managing the crisis, and by learning from the experience, improving the capacities so that a climate change and disaster risk healthcare should be in place. After mentioning these definitions, why do we need such a change? I would like to say a couple of remarks on this topic as well. Well, first of all, public health approach. Health is not an individual phenomenon. It is a part of and a determinant factor of the social life. Of course, there are certain factors which cannot be changed, but our health, when we talk about social determinants, environmental conditions are the biggest topic. And nowadays, among environmental issues, we have the climate crisis, which is a threat to the global health. And in respect of that, climate change impact on health are certain evidence. And I have tried to showcase in this diagram as well extreme weather phenomena, rising in the water and sea levels, increasing carbon emission levels. So through different monitoring mechanisms, there are different healthcare impacts. The social systems are also affected by migration, civil conflicts. This could occur. So related to climate and climate sensitive, there are many health issues which can occur. Again, as a public health issue, climate change and its scale is worldwide, but especially in developing countries, we see the adverse effects and the healthcare risks will increase significantly. In terms of its scope, especially vulnerable groups are disproportionately impacted by the climate change, and this will continue if no measures are taken. So among these vulnerable groups, we have the poor people, children, elderly, and disabled people. And most importantly, it's the preventability. Due to climate change conditions, we can do a lot of things to prevent the impacts on the healthcare. We can take the necessary healthcare measures to prevent further deterioration on the healthcare system. Again, I would like to talk about the COVID-19 experience as well, because especially this shows that the public health practices are important for society, and a system which is unprepared will have a very high economic results and consequences. And for future mass incidents, we should be prepared, and we should also involve a response component. For public health, this is an important and priority topic. Climate change and Turkey. I would like to swiftly talk about this issue as well. Our country, unfortunately, is one of the countries to be affected the most by the climate change. Rising temperatures, high number of hot days are already occurring. Infection diseases, waterborne, vector-borne, foodborne diseases or respiratory disease caused by bad air quality. Ministry of Health representatives also mentioned in the country report climate change and health country reports data. I wanted to use them, so I would like to thank them again. It is a very nicely elaborated report indeed. There are certain risks for climate change. For example, temperatures. Average temperatures will increase 1.25 to 4.29 degrees in the medium scenario, and the total precipitation will decrease. Extreme weather phenomena by the end of this century will increase, especially heat waves. Floods will increase as well. And the associated health risks, especially mortality caused by the heat, will have an important health impact on the people who are above 65 years of age. In the good and bad scenario, people above 65 linked to heat waves, the mortality ratio will increase also in our country. The increasing urbanization, the heat islands, urban heat islands also play a role. This was one of the initial information note on heat waves and heat islands. You can find the detailed information. Again, flood risk population will also increase. Poor air quality and the population exposed to that will increase, especially as it is mentioned in the report of Clean Air Platform in our country. Many cities, almost all of them even, are above the threshold values recommended by WHO in terms of pollution. And as a result of that, for 2021, 42,000 deaths which were preventable occurred. In the vector dissemination and due to ecological changes, vector-borne diseases and zoonotic infections will increase as an estimation. Leishmaniasis, West Nile virus, and the increase in the ratio is also included, and also future new risks. Viruses caused by mosquitoes are now being identified and diagnosed in certain regions in our country in this report, like Zika virus, dengue virus, yellow fever, are also in the risk of disseminating. Congo fever disease are also disseminating to regions which were not being diagnosed before. This is a situation related to climate. So, for disaster, what is the state of play? This is an important problem impacting our country in the occurrence frequency and the severity of the disasters increased in our country. AFAD has a report which is published, and we have the map of disasters of Turkey. We have various and different risks, and especially almost all regions are impacted in Turkey. You can find earthquakes, avalanches, floods, landslides, and other types of disasters. And there is no region which is spared from disasters in our country. Among 191 countries, we are number 45 in terms of disaster risks, and we are in the high-risk group in terms of the risk, which means that in the future, this risk has a tendency to increase in the future. In terms of mortality linked to disasters, again, our country has a high-risk country, and the ratio of mortality linked to disasters is among 6 to 25 in 1 million. Unfortunately, we were all impacted 6th of February, Kahramanmaraş earthquake, we have lost more than 50,000 citizens. We have more than 100,000 people who are injured, and it also caused a lot of material damage on households. Severely damaged number of households is 150,000, and the economical loss in total is $55 billion. So in terms of disaster risk, our country, we have to take precautions and measures. The activities are being conducted. We have diverse plans. We have the disaster management strategy, disaster risk mitigation, disaster response plans, and post-recovery plans are elaborated. Risk mitigation and response plans are also elaborated at the level of provinces. But the existence of plans doesn't mean that we have the capacity to cope with this disaster. It means that there are certain things which are available, but we have to do more. This is why, based on our experiences, this is our recommendation. As a matter of fact, in the disaster risk mitigation plan, for 11 different disasters, this plan includes the measures which are taken. Climate change is one of them. So among disasters, the climate change is there, but in practice, unfortunately, we don't have full integration. There is a sentence in the report which says that activities for climate change adaptation and disaster risk mitigation, as they contribute to each other mutually, they should be considered and assessed together. So, in this closing panel, the discussion, the rationale behind the discussion is mentioned in this sentence, actually. So, healthcare systems, including our country, worldwide, should be reinforced further, and shocks and stresses caused by them, caused by the disasters and climate change, should be reconsidered. Inequalities, vulnerabilities should be mitigated, and we should have a resilient system in order to ensure social and financial protection. So if I have time, I would like to talk about this system and the framework of this system. I have some PowerPoint presentations. First of all, this approach to climate resilience, it is a learning process to adapt better to changing public health risks caused by disasters. So we should have two methods. One of them should be the reduction of the general vulnerability, and the second of them should be the reinforcing the capacity of the system in general. When mitigating the vulnerability, we should focus on a healthier society and a stronger healthcare system. Especially for a healthier society, poverty and inequality should be reduced. We should have universal access to health, education, clean water, and sufficient food and basic services. And to do that, we should have a strong infrastructure, and we should have monitoring mechanisms to monitor public health, and we should have good health governance practices. I'm talking about interagency cooperation there, and as the actors in the healthcare with different disciplines, the healthcare system should play a pivotal role. The system's capacity, in order to make it more resilient to disasters and climate change, its capacity should be reinforced. This is a cumulative process. The whole system, in order for it to become more resilient, the independent components, which are the leadership, governance, healthcare, labor force, information systems and basic medical products, financing and provision of the services should be also climate resilient. The sixth component of the system and how to make them more resilient, you can see the recommendations on the screen, but in order to be time efficient, in order to talk about this in the discussion and Q&A session, I will just show you on the screen. There are certain capacity development activities related to each and every one of them, especially the human force, the information force, basic medical products and equipments, especially the climate change and finance should be at the center of the system. The system capacity should be reinforced. Maybe this is a separate discussion topic. In this intervention, I talked about why we should have a resilient healthcare system. Maybe the rationale behind and how to do that should be further discussed. As a conclusion, a healthcare system resilient to disasters and climate change is one of the fundamental functions of the healthcare system. We should establish a link with environmental and social determinants of the healthcare as well while doing this. This process, which started with COVID-19 and continued with the disasters, we learned that we should reinforce our healthcare system, and we should find methods and ways to do that. This is fundamental for the current and future problems. I would like to thank you for your patience and for your attention. Thank you very much for this comprehensive intervention. We talked about the resilience of the healthcare systems, and we had listened to very good concepts and definitions. We have our foreign speaker now, Shweta Narayan, who has been working in the public health for a long time, especially for climate change policies in India. And also in international organizations she has been working. She is an important environmental specialist and public health specialist. She is also a social worker. Today, she will talk about ACWH and why climate change is important for public health. I would like to leave the floor to Ms. Shweta Narayan. Can you hear us, Ms. Shweta Narayan?
Yes, yes. Thank you very much. Yes, I can hear you. May I continue?
Yes, yes.
Thank you. My sincere apologies for joining late. I was in another meeting. But I'm really, really glad to be here. And in fact, I was listening, I joined in when the previous speaker was speaking, and I was vigorously nodding my head because I think I'm just going to reiterate she has said. But just to sort of give a context, the health of our planet is deeply linked to the health of the inhabitants of the planet, that is human beings, that is animals, that is the whole ecology. And the climate crisis is a health crisis. It's recognized by the World Health Organization. The reason why it's a health crisis is because it threatens everything: air, water, food, shelter, security, and these are all the basics on which human life depends. And the climate crisis is not in the future. We are in it, and we are seeing it with severe temperatures, excessive rainfalls and floods and extreme weather events, more frequent extreme weather events. These are all evidence that we are living in a climate crisis. And just to sort of quickly reflect on and build on the previous speaker's presentation, which was very in-depth, according to a think tank, a non-profit research institution called Fundación CMCC, which does G20 Climate Risk Atlas, Turkey faces multiple threats from climate change: heat waves, droughts, fires, floods, and storms. And across sector, agriculture, that is agriculture, fisheries, infrastructure, tourism, everything will be deeply, deeply affected, and the cost to the economy will be massive. So and if there is no urgent action and intervention taken to respond to this crisis, Turkey stands to lose 2.26% of its GDP by 2050 and almost 8% of its GDP by 2100. So it's a huge economic cost in addition to the health cost. Next slide, please. I'm here specifically to talk about the health sector and the health sector response. And let me be clear that the health sector has a multifaceted impact in the climate crisis. It's at the forefront of tackling this climate crisis. When people get hurt, either by extreme weather events or by heat waves or by air pollution, they turn to the health sector or the health center for relief and care. At the same time, when extreme weather events happen, the health sector, the health centers get impacted the worst and become unavailable for patients. So we see the impact both in terms of the increased need, increased demand for health services in crises, but at the same time, because our health systems are not resilient, they fail to deliver those impacts when the need comes during extreme weather events. Next slide, please. Now, the health sector works on a principle, and the health professionals and this whole healthcare works on a principle of first do no harm. But unfortunately, if you look at climate impacts, while the healthcare health centers take in the victims of climate crisis, they're also causing harm. They're causing emissions that cause the climate crisis. And if we look at data, health sector emissions are now approximately 5.2% of greenhouse gas emissions globally. So if the health sector were a country, it would be the 5th largest emitter. And the majority or all of its emission comes from energy consumption, from transport, from pharmaceuticals and waste, and from operations. So this is absolutely important to know that while the health sector is at the forefront of dealing with the crisis, this paradox is that it's also contributing to the crisis. And next slide, please. So we know the problem. We know the emissions. In 2021, we did some calculations and we released a global roadmap to understand what would it need to decarbonize health sector and what would be the impacts of it. We realized that there are 7 key measures that need to be taken in order to make health sectors low carbon and by default, because they will be low carbon, climate resilient. And those 7 measures are using 100% clean renewable electricity to power health sector, zero emission buildings and infrastructure, zero emissions travel and transport, healthy food, low carbon pharmaceuticals, circular healthcare and sustainable management of healthcare waste, and greater health system effectiveness and efficiency. With these 7 key impact interventions, the health sector globally can reduce its emissions by 44 gigatons by 2050, and that means, in terms of just understanding what the 44 gigatons is, it's almost the emissions of the whole of France in 2019, all of carbon emissions. There is a research that was published last year that said that if we continued with business as usual, and we reflected on business as usual for Turkey in terms of impacts and cost. Globally, if we continue business as usual, there will be 70 million more deaths because of heat stress alone. Now, if the health sector globally incorporated the 7 key areas of intervention, they would be able to save at least 5 million lives. So the health sector intervention is absolutely important, both in terms of adopting low carbon measures and also making itself resilient to extreme climate events. Next slide, please. I think we have the problem, we have the solution. I want to reflect some time in terms of what is happening around the world so that we can learn from those good practices, we can get inspired by it and incorporate it in our own respective systems. There has been, in the last few years, we have seen an increased initiative within the health sector to change its way of operation. And as part of this commitment to Race to Zero, now we have 70 health organizations representing 14,000 hospitals and healthcare facilities in over 25 countries around the world who have committed to low carbon healthcare. That means decarbonizing their buildings, their operations, and supply chain. And that is a tremendous commitment from health sector that is getting more and more aware of its own impacts and is aligning its practices to the philosophy of first do, no harm. There are global initiatives anchored by the World Health Organization, and last year in 2022, the World Health Organization launched this Alliance for Transformation of Action and Climate and Health, attached. Next slide, please, where it focuses on climate resilient, low carbon healthcare. And the goal is to ensure that public health is at the center of climate action and that countries have the information, the tools, the mechanisms to protect health of the population and take actions that mitigate the impacts of climate change. And as of now, there are 66 low, middle income and high income governments who have joined ATTACH, and there are more than 20 out of the 66 governments who have also pledged to net zero healthcare. I think it's an opportunity. The resources are available. The initiatives at a global level is underway, and it's opportunity for countries to join. And this would be a huge opportunity in terms of knowledge sharing, tool sharing, and ability to transform the health sector to make it truly climate resilient by joining initiatives like ATTACH. Next slide, please. Now, I don't think it's enough that the health sector takes this action within the sector to make itself low carbon and climate resilience. I think it's an opportunity. The climate change, the climate crisis is an opportunity for health sector to show leadership beyond its sector. And we have seen this. We have seen this during COVID in the last 3 years, how the health sector has taken that leadership, how health professionals have taken that leadership to protect people, to shape policies that can protect people from the pandemic. I think we have the framework. We need to adopt it. We need to modify it to responding to climate crisis. And this is where in the health sector, the leadership of health sector, and particularly the health professionals, is absolutely important. We've seen it in COVID, as I said. The health professionals are the most trusted messengers. And this is not a statement that I'm making up. This is the fact that statistics say. Globally, doctors are the most trusted messengers for people. And unfortunately, the least trusted messengers are the politicians. So health professionals have a very important role in carrying the message to the public, to protect the public, and also use the evidence that they see in their clinics daily to inform policies. So they play this twin role very, very importantly. I think, next slide please. Again, when it comes to leadership, I would like to recognize the leadership that World Health Organization has taken in terms of highlighting the impacts of the climate crisis, but not limiting those messages to just how do we adapt the health system to low carbon resilient, but also highlighting the core cause of climate crisis and highlighting the need to take action at tackling the climate crisis at its source, and that is fossil fuels. The use of fossil fuels not only drives climate change, it also drives air pollution, which kills about more than 7 million people globally every year. And last year, the World Health Organization, along with 300 other health organizations, took the leadership in calling to end fossil fuels use, end our dependence and our addiction to fossil fuels, and move towards, in a just transition manner, move towards low carbon economy, which is fueled by clean, sustainable, healthy energy. And I think this is a very important leadership, that role that the World Health Organization is playing, and the health community needs to come together, and other communities also other sectors need to come together. Next slide, please. I think when the health professional voices are very important, at the same time, it's important that we invest in our health workers. They are our link between the policymakers and the general population. They are the trusted people at the community level, and their experiences are very, very important in framing policies. So it's important that we build capacity of our health professionals, equip them with the latest information, knowledge, so that they understand the impacts of climate change, they understand the impacts of air pollution, they understand the impacts of heat stress when they're treating their patients, and they are equipped to truly provide the care that they have been trained to do. So it's absolutely important. It's not just important to look at health systems. Health people make systems, health professionals make health systems. We need to invest in our health professionals to transform the system, to make our systems, health systems, resilient and low carbon. Next slide, please. And this will be my final 2 slides. I just want to again recognize the role of health professionals. I want to highlight that yes, that we are engulfed with a climate crisis that is absolutely it's devastating. The impacts are devastating. But I feel, and this is again looking at everything that is around in the leadership of World Health Organization, that there is an opportunity in this crisis, and there is an opportunity to transform our health systems, to make them resilient, to make them not only climate resilient, but to make them the anchors of community resilience, to look at health systems that are preventive in nature and not just curative in nature, to make them the leaders in voices that protects people and protects the planet. I think as the guardians of human health, it's the responsibility of the health sector and to act on climate in a manner that inspires every other sector and that advocates for phasing out of fossil fuels and at the same time protecting the most vulnerable from the threats of climate change. I thank you very much for this opportunity and for your patience to listen to me. Thank you so much.
Sevgili Narayan'a biz çok teşekkür.
Thank you so much, Narayan, and you have explained us greatly the question of why is climate change a health problem, and you have stated that this is not a future problem. We are now facing this problem, so we need to handle this issue with great care and with great importance. Thank you so much. Will you stay in this session till the end, so we can have the questions now or at the end of the session?
I'm happy to be here. Please go ahead, depending on however you've structured the question. I'm here to listen in and learn from all of you. Thank you.
Çok teşekkür ediyoruz. O zaman
So thank you so much for your understanding, and we will continue with our next speaker, Dr. Lawyer Fevzi Özler. He is a lawyer and he has great advocacy activities actually, and now we will hear his presentation. He will take a perspective from the legal point, what kind of a climate law that we need. This will be the topic, so the floor is yours. Thank you so much for your kind invitation. Indeed, I am quite lucky because I have two great previous presentations ahead of me. And in my speech, we will be discussing the current legislation, and I will be touching upon historic facts. Why do we need a Climate Act? Because these problems get globalized, and we do see intense impact of it. But we shouldn't see Climate Act within just this perspective. When we check UN and EU's 2030-2050 goals for climate and the reasoning behind the legislation in EU, for example, we see that they have a different perspective when we compare it from the historic discussions in regards to climate. Right now, climate crisis is not just an environment crisis. This is also an economic problem, for example. When climate crisis reveals itself, we see its impact on civilization, and we see how our lives changes. So we do accept that it is in a point to have an impact on all our lives. And within that direction, the climate regime needs to be discussed in institutional capacity, but in which institutional capacity? Surely, to give an answer to that question, we need to first identify the problem accurately. When we have the right scope to discuss this problem, then we can find the right institution. The principles, the authorities, the duties, the responsibilities, all could be identified following the identification of scope. This is the reason why it is such a crucial issue. Till Rio Plus 10, we had 40 years till 2012. And climate change was revealed as an environmental problem so far, and we had certain principles to deal with this. However, the most important one, for example, is to prevent climate crisis. This was the higher and most common point of view. This was the approach to this topic. However, then we had this perspective of sustainable development, as you do know, by preserving and protecting natural and cultural elements. We need to have a sustainable development. There are principles in regard to countries and companies to take responsibility over their actions which disrupts nature and climate. If there are no guarantees in regard to financial losses of people because of climate crisis, then of course we need to discuss this issue within a greater perspective. We need to have a balance in between environment and economic situations of people. It was first described in 1990s, and international acts, laws have been prepared. International law means that this particular provisions could be applicable by different countries in different regions. So, an act for climate have been prepared, and this law regime is not a single one particular act, but it is adopted by different countries, and they are following certain principles, and this regime, this legal regime provides a timeless perspective, actually, because you may change it through time with changing circumstances. Following 2012 IPC reports prepared by a scientific committee revealed that we are facing a problem which is beyond the borders of prevention. Now we are in the stage of adaptation. We need to adaptate ourselves to current circumstances. Scientific information and data enlighten us in regard to the fact that we can't prevent climate change anymore, but we need to adaptate ourselves. UN's 2030 reports also state that we need to have a structural change to overcome the challenges. And Green Deal, as you do know, is the core and essential document for all the countries. We need to meet our goals to keep up with zero carbon by 2030, for example. There is a schedule and there is this concept identified to keep with these goals. What I'm trying to say is that climate crisis is not an environment problem. This is not a sectoral problem, for example, within the eyes of EU or UN, and it requires legal preparation and legal amendments to tackle with current problems. We need to activate certain tools, and actually we are too late to activate these tools. Though certain principles stay intact, we have new principles as an addition. In 2021, a framework was adopted, but that framework does not give you all the details, actually, and it just gives you certain lines, and you may adapt your actions through time with changing circumstances, as I've stated. And we need to also adaptate our manufacturing procedures, because there is a certain contribution to climate problem and environmental problem. What I'm trying to say is that we need to take a perspective to identify climate change as not just as an environmental problem, but also as an economic problem too. And this is such a topic that we need to discuss in length. And indeed, at national level or regional level, we may see certain impacts of it. However, you can claim that the impacts of climate change is exaggerated. There could be no huge impact on the economy of a country or a region, for example, but you may also claim that with climate change reports and regulations for climate change have all these basic principles and rules to alleviate the goals and to diminish future possible problems. But as I've stated earlier, we need to activate certain tools. Financing tools and funding tools needs to be activated. And from that perspective, I can tell you that you need to establish a sound connection in between these tools and the problem. You need to have a dynamic approach. And at this point, we do see that there is no one focus on one sector to provide these funds, starting from individual rights and to community rights. This is a violation of rights, actually, because climate change causes certain violations in individual and community rights. And we can tell you that in Turkey, Climate Act is organized and prepared as a sector-specific act, and there are certain capacity building activities towards this goals, but I believe being sector-specific will cause certain problems in getting funding for this activation of tools. In other countries, we see a much comprehensive and holistic approach to this issue, and because of that, there will be certain problems in creating sectors and sub-sector goals also. Ministry of Environment, Urbanization and Climate Change prepares the acts for climate change, but also there needs to be a common understanding in between public authorities and policy makers while they're taking their own actions against climate change. If they adopt different perspectives, for example, then there will be problems in regard to institutional capacity and in collaboration, for example. I believe that there could be certain resistance to adopt specific goals to fight against climate change. And whenever we have, for example, disasters, we discuss this transformation in healthcare system. However, we need to develop all these sustainable and resilient city policies without even experiencing the disasters. We need to discuss these issues on an individual basis
Senin inşa edilmesiyle ilgili.
There are certain difficulties in establishing institutional capacity, and also while raising the awareness of the individual, we are failing at providing them with a certain perspective. And the situation being so, climate change becomes an environmental problem, a sectorial problem, and within the scope, legal arrangements, beneficiaries, stakeholders, many different sectors are refraining from becoming an actor, or they do not know how to establish a link with the issue. So to sum up, this climate regime at the level of the EU can be accepted as a scale for us. The rationale and the reality behind it, environmental deteriorations, are now impacting the economical life, and the long-term costs should be planned from today. And especially the international law provides certain advantages to us, and we can make use of them in the efficient manner. The flexible legal regime and these methods and the chance to benefit from international finance mechanism helps us to establish a plural climate policy so that we can use the correct resources with the correct tools and correct methods. Thank you. Thank you very much, Mr. Fevzi. This was a subject that I knew very little, and you have made a very comprehensive intervention. So according to the EU legislation, we are a bit lagging behind compared to them. We are making the preparations for a more general law. Now we have the last speaker from Bahçeşehir University, Dr. Melike Yavuz. She is also the project coordinator of this project. Therefore, as the last speaker of this session, she will also wrap up about the ÇİSİP activities. So we will be receiving a general result and outcome of the project, and also concerning the Turkish health system, healthcare system, how to ensure a system which is resilient to climate and disasters. What are the roles and duties of us health professionals? Please, the floor is yours. Thank you. This project started with the pandemic period. It was 1st of April 2020. We couldn't start face-to-face, and we are closing the project face-to-face, so I'm quite glad to be able to do that. Thank you very much for your participation. I would like to respectfully welcome you all once again. The main purpose of this project is to increase the capacity of health professionals. So we wanted to get back to our essence with the pandemic. I wanted to start with this cartoon. It was at the beginning of 2020. 3 threats menacing the world. If you might remember, COVID was still prevailing. We were still feeling its impact, the economic recession. We are still currently feeling it quite deeply. And the World Economic Forum, by the climate change, was also identified as one of the menaces, threats, maybe the biggest one, actually. What kind of role should the healthcare professionals should play, and why they should play a role, and what could be done will be the layout of my presentation. So why health professionals should play a role in ensuring resilience? Of course, we are talking about the health system's resilience, but it has many aspects, not the health system only. As it was mentioned by Mr. Fevzi, it encompasses all production and all the relevant sectors, actually. But we have to start with the health system as health professionals. Again, in 2021, the World Health Organization identified climate change as the biggest menace to human health. And the commitment was, within the framework of IPCC, to limit the rise in the world's global temperature to 1.5 Celsius degrees. We had this concern of limitation. So any kind of heating on 1 to 10 has very adverse impacts on the public health. When we first started this project, especially the social awareness and public professions awareness was not quite there, was not quite raised, but climate change also made us raise this awareness. Recently it became a quite popular topic, and we have made a research of which I will share the findings soon. Climate has an impact on health. We have perception researches and we have raised awareness of health professionals. But we have to fine-tune it now on which topics it has an impact and how to establish the context and how to respond to the situation. So why health professionals? Why? For all the world, for all the citizens, health professionals should be able to provide the citizens with this evidence, with this proof, with this knowledge. So they play a role and they have an important role to play because they have the trust of the population. Maybe you are sharing the most private things in your life with the health professionals, which is why still there is this trust relationship with them. Of course, we need to fight against the climate change to protect health and improve it. And on the worst scenario, on the worst case scenario, if we cannot do anything, the ones who are to face the consequences are health professionals. And the research say the same thing actually. People don't have many skills in identifying the health disasters linked to climate change, especially vulnerable groups have a higher risk. In 2015, there was a research conducted in New York in the protection against diseases linked to heat. People lacked knowledge and the skills to cope with them, and which is more prevalent among Hispanic and black people who have a lower level of income. So this population did not have many increased level of knowledge. In 2021, we had a research on health professionals, and we enlarged it in Europe, in Serbia, and UFA, European Health Public Health Association, was used in this study, which is conducted, and its report will be shared soon. Especially physicians, they were the subject of the study. We had worked on their perception of the climate change, knowledge and perception. We disseminated this study through Serbia and UFA on the physicians. It was an online survey. Social demographic information, climate change perception, and knowledge was assessed, and the perception, the approach of the physician on mitigation and adaptation. We had 508 participants. So this is a quite high number actually, and majority of the participants are from Turkey. We asked them whether do you experience climate change, and their answer, in the country that you live in and in the city that you live in. Majority of them from Turkey, Serbia, and from other European countries, they said that yes, I do have the impacts, the changes of climate. Especially recently, heat wave, droughts, floods, these extreme weather conditions, whether they increase recently or not, majority of them said yes, that they were increasing in 3 countries. To what extent they felt under threat compared to these incidents and phenomena in Serbia and European Union countries. And if we are to pay attention to Turkey, except these regions, the risks are higher among the Turkish physicians.
Kendi mesleğimiz üyelerinin, yani tıp doktorlarının,
Medical doctors,
üzerindeki etkilerini ele alırken,
when they were,
var mıdır sorusuna,
we asked them whether they play a role while
oldukça güçlü oranda
assessing the climate change impact on health. They agreed.
ve daha fazla eğitim,
I have the necessary skills and the necessary education,
uzmanlık ve beceriye sahiptir konusunda yine de içimizi acıtmayacak rakamlar olmakla birlikte tabii
even though these are not
rol oynayabilir ve sorumlulukları
bad figures,
yerinde olacak şekilde.
still it is not the desired outcome. We think that they have certain level of knowledge and training, but they said themselves that they need more knowledge and training. For healthcare sector,
Üzerindeki etkilerini ele alırken
climate change impact,
bu konudaki önlemlerle ilgilenmeli mi?
whether they should take care of the precautions, whether they should take measures for mitigation and adaptation and preparedness,
Buna ilgili
and the level of interest were the questions.
önlemlerle kesinlikle ilgilenmeli.
Yes, measures should be interested in. For mitigation and adaptation, we have the capacity, but for preparedness, it's insufficient, and they are not quite interested based on the responses.
Devam edelim. Bu araştırmanın sonuçları bu ay içinde ayın sonuna doğru
The results of this survey will be shared with you as an information note by the end of this month.
daha fazla soru sormak isterseniz sorular bölümünde
If you have more questions, we can further discuss in the Q&A session. So what kind of role they should play?
iklim direnci oluşturmada bir rol alması
We are now clear that they have an important role and they should play a role in climate change,
nasıl bir
health professionals. So what kind of role they should play?
sürdürülebilirlik oluşturmak sağlık çalışanlar için nispeten yeni bir yaklaşım.
This is a quite new approach for healthcare professionals, so raising awareness,
Ve güçlendirmek
training them and reinforcing them
şekilde uygulanması için en temel gerek
is one of the most fundamental necessities to improve capacities of the healthcare system. World Health Organization identified 10 components in order to render health systems resilient to climate, as it's mentioned by also Ms. Çiğdem Çağlayan.
var.
First of them is leadership and management.
Burada sağlık profesyonelleri bu 10 bileşende neler yapabilir
What
dair
kind of role healthcare professionals can play among these 10 components? Maybe we can fine-tune them in the future processes to come.
bu 10 bileşenin üzerinde neler yapabilir?
What kind of activities could be organized on these 10 components? Building blocks, as it's called by WHO, has identified 10 components. First of them is leadership and management. The main purpose of this component is that the climate change main aspects are reflected in health policies and programs. So we should do first advocacy, and in the elaboration of such programs, with our knowledge and experience, we should play a role. Healthcare human labor force. It's quite critical, especially healthcare personnel's technical and professional capacities, training, learning and mentorship opportunities should be reinforced. We immediately talk about training and courses when we say capacity and short sessions, but we are actually talking about the whole health curricula, from the 10th year to 6th year of a medical training and education, from internship to infection diseases courses, all kinds of aspects should be included in this training. Vulnerability, because we have the death toll among the most vulnerable groups. They become ill quite easily. So which part of the population is most vulnerable against this kind of impacts, and identifying their weaknesses and identifying adaptation alternatives and response. So our scientific knowledge should be included. Health and climate researchers, we need to provide evidences to what? to social and environmental determinants, alleviating impacts, the climate sensitivity of diseases and health risks, how the society perceives the risks and how they cope with, and societies and local health services level of being ready to cope with the crisis.
Sağlığın çevresel belirleyicilerinin yönetimi,
Management of
elbette sağlık sektörü
environmental determinants of health.
söz sahibi değil, kontrol
We don't play a direct role
sağlama fark
as healthcare professionals, but we can provide evidences and raise awareness. We can monitor environmental risks and its results, define standards, for example, air quality standards, while they're being determined. Of course, it is based on the healthcare results. We play a role, we play a fundamental role,
özellikle sürveyan sistemlerinin kurulması,
especially establishing surveillance systems. We should do advocacy activities, and we should do the monitoring once they're established, assess the results, and report to the public.
ve iklim değişikliğine esas alınan sağlık programları bu bileşenler
Healthcare programs which are taking climate change as a basis,
sağlık sektörü iklime duyarlı sağlık risklerini, örneğin vektör kaynaklı
vector-borne and waterborne diseases,
hava olayları sırasında
extreme weather phenomena, and the relevant health responses, and nutrition crisis, because this is one of the most important consequences, the drought and the failing to access to food, increase in the food prices, and this will have further repercussions on poor people and people who have already limited access to food.
de yükümlüyüz.
We are also entitled to
Yönetimi,
establish the necessary preparedness plan
afet riski
for emergencies,
planları ve acil durum sistemleri
which foresees certain risks and their mitigation,
için gerekli
which are necessary to create resilience.
ve bir şekilde dahil olmalı.
We should be a part with our experience. So,
Nereden başlayalım?
where should we start? Here.
Buradan başlayalım. Çevre iklim ve sağlık için işbirliği.
Cooperation for environment, climate and health. This is a closing event of a project, but this cooperation will continue.
Öğleden sonraki oturumda nasıl
And in the afternoon session, we will talk about how to continue. Who are we? I think you already know.
uzmanları iklim değişikliği etrafında bir araya getirmek.
This is the first time we bring together the professionals among the climate change and environment with a university, with an NGO, and with an association. It's a network, actually. It's a very good component and a network. There are not many examples worldwide. We have more than 200 experts and association representatives who are also with us today.
Bizler neler yaptık?
So what did we do?
Bunlara şahit olduk.
Some of you already witnessed,
Sen de çok çalışmışız diye de düşünmeleri
and while resuming all the work, I said to myself, we did a lot of things. So, we wanted to raise awareness, and therefore we organized webinars, social media packages, we published articles.
bildiğimiz, bu süreçte de öğrendiğimiz kadarıyla yapmaya çalıştık.
This is what we wanted to do as much as we can.
Özellikle
On the social media, especially to inform public and health professionals,
paketleri hazırladık.
we elaborated certain social media packages. We have a glossary
İlişkili iklim ve sağlık etkisiyle ilişkili
each week.
işte
We share this on the social media.
yapmaya çalışıyoruz. Onun dışında uzmanlardan yine topluma yönelik mesajları
From experts, we receive certain messages for the society. They are part of our network.
öğrendiğimiz, yani daha farklı konularda çalıştığını öğrendiklerimizden hem mesajlar aldık hem programımıza dahil etmeye çalıştık.
We receive messages and we try to include the ones who are also working on other disciplines as well as experts. We published articles on journals and newspapers. So we wanted to reach anywhere possible.
Sağlık profesyonellerinin kapasitesini artırmak bizim hedeflerimizden bir
Increasing the capacity of healthcare professionals was one of our objectives. We prepared information notes for this purpose.
Önümüzdeki haftalar içinde tekrar yayınlanacak bilgi notlarımız da var. Özellikle
We will have
etkilerini de artık konuşalım.
further information notes to be published. We worked with the
Bu ayrıkmadan
Turkish Psychiatry Association as well. We organized courses, especially for young professionals,
değerlendirmesi,
health
artı
impact assessment, how to use RQ program.
Ve kongrelerde paneller yaptık.
We organize panels within the framework of congresses to inform our colleagues.
Ve deneyimlerimizi paylaşmaya çalıştık.
And we try to share our experiences in the sessions. Not only the share of theoretical information, but also as an activist what we have done, what we succeeded, or what we failed to do so.
Yetişmeye çalıştık.
And we wanted to reply to everybody's invitation.
Ulaşanlar oldu.
We were also reached out through social media. So, on various platforms, we wanted to raise our voice on climate change.
Unsurlarından bir tanesi de savunuculuk.
Advocacy,
Genelde iklim
one of the most important components. Because when we talk about climate change, we perceive it as something beyond our power, but it is at the level of global.
ve bu konuda da bizim birey olarak hiç yapabildiğimiz
Stopping the use of fossil resources, and there is nothing we can do as an individual basis, but we talked about resilience, mitigation, and adaptation. There are a lot of things to be done,
yapmaya çalıştık.
and we have organized advocacy visits.
Bundan bazıları
Some of the photos of which you can see on the screen. Of course, initially they were held on an online basis.
yapamadık. Dediğimiz gibi çok önemli
We couldn't hold visits during the pandemic period. We couldn't come face to face.
mektuplarımızla ya da
Through our letters or
dergilerden
from certain,
seslenmeye çalıştık.
we use certain journals.
26 delegasyonuna tavsiyeler vermeye çalıştık.
COP26 delegation, we tried to provide them with our recommendation, and
İlişkilerimiz üzerine.
through our network and through our relations with the contribution of HEAL,
için hazırladığı uzman raporuna
the expert report of WHO for COP26, we were a part of the activities conducted.
aklımıza estiği anda da karar vericilere seslenmek.
And anytime we felt the need, we tried to raise our voice to the decision makers. We wanted them to include the healthcare workers in the process.
En iyi bildiğimiz şey kanıt üretmek.
And the best thing we do is to produce evidences, and we try to do so.
Anket çalışmasıyla sağlık çalışanlarının
By conducting the survey,
ilgisi ve farklı
we tried to assess the level of awareness, knowledge, and experience on climate change of healthcare professionals, which was presented in the Congress. As I mentioned before, it was enlarged, and it will be shared with you.
anketlerde gördük ki sağlık
And we have seen in the surveys that healthcare professionals,
çok önemli bir role sahip olduğunu gerçekten düşünüyor.
they think that they play an important role,
Daha fazla desteklenmeli.
and they believe that they should be supported and their capacity should be increased. So, while concluding my remarks, this is a closing event of a project, but each end is a new beginning.
Yani bundan
Therefore,
adımları atarken
while taking the future steps,
çok kıymetli.
there is a good experience and progress made
Bu birikimi
here, and by disseminating this knowledge and experience, we can enlarge in this network. Thank you.
Çok teşekkürler
Thank you very much,
Yavuz.
Miss
Senin yerine
Melike Yavuz.
gerçekten aslında
Indeed,
Melike'nin sonunda
in her presentation,
Sırbistan ve Avrupa Birliği
Turkey, Serbia, and EU surveys
çarpıcı
results are quite striking. In my opinion, all of the doctors, physicians in Turkey
çevre sorunları ve iklim
concerning environmental issues and climate change,
kaygı yaşıyorlar.
they have a significant concern. Even though we are a country who is constantly concerned about something, this is still quite interesting to me,
Araştırma yapmak ve ne kadar önemli olduğunu
which also proves the importance of conducting surveys and researches. ÇİSİP team, because
ne kadar sorunun kaynaklarının belirlenmesi ve çözümüne yönelik olarak
the more we have the solution-oriented researches,
eğitim yaparak
and the more they can provide evidence, they become more important, and they should be supported by the technical and scientific activities. So today, shortly in this panel, in this session,
sisteminin ve genel olarak
we have seen that the healthcare system in Turkey and the systems in global scale
özellikle ilk
for crisis, and especially for climate crisis, they should be built in a resilient manner, and which is possible because
içerisinde
in the healthcare system,
yatırımları
if we can make the necessary investment, if we can find the financing mechanisms, if we invest in human resources, and if we establish the legal background as well, and if the governments and extra supra-governmental institutions and in a democratic environment, if we can involve NGOs and the general public, and by ensuring the separation of powers, we can solve all these problems.
Salondan katılımcılarımıza yönelik
Now I would like to turn to the floor for the Q&A session.
Çağlayan, Özler ve
Do you have any questions for our speakers, to Ms. Narayan, to Çağlayan, to Özer and Yavuz? And then I will leave the floor to our speakers for the final closing remark. We will close in 12:30, so we have 20 minutes. So, the floor is yours for the questions.
mikrofon lazım.
Mr. Gökhan,
Bir dakika Gökhan. Çeviri içinde
for the interpretation, we need the microphone.
zaman kaybettiğiniz
First of all,
sonsuz teşekkür
I would like to thank everyone
İçine
very much.
çalışma oldu.
This was a quite interesting conference indeed. This is the problem of today, not of tomorrow's. Only for the air pollution purposes, there was a break from schools, so the children were deprived of their right to access to school. Turkey is ranking 46th among more than 190 countries, and we have 5 very polluted cities in Turkey, and people are losing their lives due to the bad air quality. So this means like an earthquake in each year, which is undesired, and air quality is among the number 5 among the death reasons in Turkey.
Sağlık Örgütü'nün göstergeleri 4
The indicators of World Health Organization, we have the 4 times more than the threshold values.
yani sadece
So the image being so, if we can focus on the air pollution,
ve kadın sağlığıyla
it's
tüm değişiklikler arasındaki ilişki
the relation between the women's fertility and the climate change,
kuşakları artırılmasına kadar
the transformation of women, empowerment of women, transferring their skills to the future generations.
bu ağın genişletilmesi
Enlarging this network, as it was mentioned by the previous speaker, is quite important.
kadının güçlenmesi
Women's empowerment, women's rights,
ve çocuk hakları ile ilgili derneklerin
the associations concerning women's rights and children's rights should play an active role in public health as well. Do you have such a plan? And my other question is to Mr. Özer.
çok müdahil olma gücü yok. Yani
People who are impacted by environmental issues, they don't have the power to be a part of the decision-making process
yönetimleri yerel yönetici
in the local management, in the local authority.
orayı etkilemesi gibi şeylerde hani merkezi otorite gücü kullanırsa kullanır.
So we have the central authority who plays a role, but the impacted population, do we foresee anything to ensure that they can also play a role except litigation mechanism? So in the legal mechanism, how we can involve them
Ansal olaylara katkı, görüş veya gönderme
so that they can provide instantly their recommendation and their feedback to this kind of decisions? Thank you very much. Do you have any other questions?
Buyurun.
Please,
Soruları mümkünse kısa alalım.
if you can
Sevgili
address your questions quickly, because Ms. Narayan will have to leave sometime soon. So, my question is for Ms. Narayan. I'm a medical student. This is why my question will be related to the medical issues. We talked about the carbon emission of healthcare systems in the medical education. For the reduction of carbon emission in the training and education, the subjects to be added in the curricula, what kind of impact they can have? Because the hospitals, the buildings that we work in the energy part, we don't play a role as healthcare professionals. So how this can impact our advocacy? And do you think that there could be a positive impact while doing advocacy? Thank you.
Merhabalar, ismim Ayşe.
Hello, my name is Ayşen Özman.
Müfredatı denilince bir şey sormak
I wanted to ask something about the medical curricula as well.
ve sağlıkla alakalı
In the medical school,
verilmiyor.
there is no significant training provided for climate change. I have taken a look at the curricula of all the medical faculties, one by one. What could be done? What could be added? What is your opinion? So, how we can add this topic to the curricula? Thank you.
Sevgili Narayan hem de bizim konuşmacılarımıza Türkiye ve
So this question could be answered by Ms. Narayan and to our Turkish speakers.
Pardon Narayan.
Sorry, Ms. Narayan. We still have a couple of questions from the floor. Then you can answer.
Öncelikle çevreyi koruduğu için
First of all, I'd like to avail this opportunity to myself to thank all the stakeholders for their contribution in protection of the environment. My question is to Mr. Lawyer Fevzi Özler. We are carrying out many evidence-based studies, just as indicated by Professor Çiğdem. Until the year 2100, we have got a lot of casualties to suffer. In terms of legal issues, what are being done in Turkey and what are carried out in Turkey within the framework of law, and what is your projection and what is your predictions pertaining to the year 2100 in Turkey? If it's a question, please let's hear it. If it's a contribution, let's keep it at the end. Both Fevzi pointed out that it wouldn't be correct to assume the climate change as an environmental issue, and Melike pointed out a large framework on where the tasks obliged to the public health specialists. As public health specialists, our task is to determine the elements, determine the factors underlying the climate change, and we need to advocate for prevention. So far, the conclusions that I have derived from what I have listened to here is that these are the basic fundamental economic problems that Turkey suffers as well. For example, coal-based power plants. We are still living in a country where these power plants are incentivized. We are living in a country where forests are destroyed. We are living in a country where the air pollution, nothing is done to prevent air pollution. These are all issues which are under the jurisdiction of decision makers. For example, have you ever taken any initiative of advocacy for decision makers? Have you ever visited political party leaders asking them, what are you doing for climate change? Or did you have the opportunity to talk to them? These are the problems. What are you doing about them? Or what about you, Fevzi? Have you done anything to communicate this problem to the decision makers? And Professor Çiğdem, have you carried out any similar initiative? Thank you very much for the question. Let's give a break for answers, then we will continue to turning back to the hall. First, let me give the floor to Ms. Narayan. There were a couple of questions directed to her. One of the questions was about the curriculum of the medical training, particularly on the international level, the approaches of healthcare systems and their approaches toward carbon footprints and their mitigation. What are there? And maybe I can contribute to this question by adding maybe India and Turkey could be compared to one another. We are both developing countries. We are trying to we are like peripheral countries within the capitalist system. So the political decision makers in this regard are actually taking the profit-generating activities of the capitalist system into the foreground. How can we take these issues into account while considering our actions? Ms. Narayan, the floor is yours.
Just on the issue of curriculum, I think young medical professionals in the room have hit the bullseye. It's the biggest gap right now we see, which there is a lack of updating of medical curriculum to catch up with the current health challenges and crises that the medical and public health community is seeing around the world. Colleagues from International Federation for Medical Students Association, IFMSA, did a study a few years ago where they looked at how many places in the world where medical curriculum exists, and they found I think there were only 12. I don't know, I mean, most recently, like this year, Harvard Public School has finally integrated climate change and health impacts in their medical education curriculum. This is a very big gap. If we are training medical students, the future health professionals, to deal with crises of present and future, then we have to equip them with the knowledge, with the solutions to tackle that challenge. So the curriculum gap is absolutely real and very severe and needs to be tackled at a priority. In fact, the curriculum has to be designed in a way that it trains students in different regions, in different places, skills that they can include in treating and healing their communities in those geographies. The impact that health professionals can have when it comes to climate actions are at two places, actually at three places. One, within their health systems. So I don't think that, to believe that they don't have a role within the healthcare facilities is a right approach. The solutions to decarbonize health systems and making them low carbon and climate resilient is available. It's important as much as we protect communities to change our ways of operation within our health facilities, and health professionals have a very, very important role to play. There's a lot of research, there's a lot of changes that are happening in the US, in the National Health Services systems in England. There is a whole movement of health professionals leading in greening the operation room and reducing medical waste, chemicals used in procuring materials that are sustainably produced. There are a lot of examples that are being documented around, and we need to learn from these examples and incorporate them in our own facilities. So health professionals have a huge role to play. They also have a role to play in protecting communities, the vulnerable populations, and they also have to, the health professionals don't have to lead all the fights, but they have a role to play in all these advocacy efforts. The evidence that they are seeing firsthand becomes the scientific proof for moving policies. Share that knowledge, share that information to as many people. You might not have the time or the resources to advocate around it, but if you put that information out, local impacts of air pollution, local impacts of fossil fuels, local impact of changing disease pattern, other groups, and this is where collaboration comes in, other groups will take this information and use it for advocacy. So you don't have to lead all the fights, but you have a very important role to play in these fights. I think just to 30 more seconds, sir, for addressing your question. Turkey, India, very similar geographies, very similar economies, I would say very similar vulnerabilities. We are among the most vulnerable countries when it comes to effects of climate change. It is even more important for our policymakers, for the politicians, for the decision makers to care for the people over profits. And that is one thing I think as solidarity we can share. Citizens, health professionals can lead this conversation to make policymakers think about people first and profits later. Thank you.
Biz çok teşekkür ederiz. Belki salon için çok kısa bir özet yapayım sevgili Narayan'ın söyledikleriyle ilgili.
Let me summarize briefly what Narayanan has said. There is a big gap in the curriculum all around the world. This problem is a problem for the whole world. But for the solution of this problem, there are particular things to be done, particularly for climate and environment problems, and approaches pertaining to these problems can be carried out with local initiatives and non-governmental organizations. And in all countries, particularly in countries like us, the predominant aspects of the policymakers were something else that she also put an emphasis. I'm going to start with Melike. You have taken a note of the questions. Please, the floor is yours.
Thank you so much for this opportunity. And indeed, I would like to state that We are thanking to Gökhan because he has highlighted the issue of vulnerable groups. Yes, the vulnerable groups will be affected the most. Women, children, migrants, refugees. These groups will be the highly impacted ones, and I will do my best to include this topic to afternoon session. And in regards to curricula, we do collaborate for that particular topic for a while. And indeed, we tried to figure out the ways to integrate this information into the curricula of Faculty of Medicine. Of course, we are doing our best, but we need to have a holistic approach. We need to have this unified approach, and surely we need to catch up with the world. And it is quite funny. It was just mentioned, Harvard University has this effort to adaptate their curricula to this climate change, and it was quite interesting for us to see that Harvard University, such a prominent and such a significant and important university, is now taking these steps. So they are somehow late, and this could be just the sign for us. And we have added a 14-week course. 1 week I will be delivering the presentation, and the other week my students will be delivering their presentations in regard to the climate change issue. And for example, last week they have provided a presentation in regard to historic values of European citizens following the pandemic, and we tried to figure out its relation with climate change. We wanted to understand, as we share a quite similar climate with Europe, would it be possible to see these new diseases in Turkey as well? If you do not have a diagnosis for that particular disease, for example, you cannot treat it either. So we need to understand newly formed diseases. We need to see the world, and of course you can form all this information and all this program by following all the developments. We have updated our curricula in 2020, but we know that there is now an update effort for that curricula. You need to all take part in this effort, I do believe. It is not possible to solve this problem or raise awareness by just adding one course or two lectures on this issue. There are numerous techniques to teach it. You may provide theoretical information, you may add certain practices, and it is not just necessary to accumulate knowledge on this, but you need to teach people, your students, how to manage crisis, because we are talking about climate crisis, we are talking about disasters, and they need to be aware of the situation, and they need to be capable of managing crisis in certain situations. And indeed, we have implemented our project during the pandemic, and we tried to come together, we tried to meet face-to-face. However, mostly we have organized all our meetings on online settings, and we decided to come together recently, but then unfortunately we have experienced a devastating earthquake. So while preparing our heat wave briefing, we had organized a webinar and a our experts from Europe came together with us. They have informed us, and Ankara, Istanbul, and Izmir metropolitan municipalities. We have received their messages because they are now interested in all these plannings, and hopefully we will integrate all these plans, and we will provide our briefings to local administrations first, and hopefully we will take steps further. Early warning systems was a question mark in our minds. We thought that there was nothing like that. However, the DG of Meteorology told us that there is an early warning system already in place, but it is not working as we imagine, because you need to have a plan. If there is a heat wave coming, for example, you need to prepare your people. Do we have enough infrastructure to provide assistance to people? And what if there is a wildfire, for example? Unfortunately, at this point, we do not have sufficient infrastructure to deal with possible disasters, and I can tell you that this infrastructure is both technical, and we don't have enough human resources also. We shouldn't be just publishing advocacy papers in this project, but we need to convince decision makers on this topic. Hopefully, after the election, now we are in post-election process, and we will get in touch with MPs and we will inform them about our efforts. Thank you so much. Now the floor is yours, Oscar. One participant asked that, would it be possible to take some steps in regards to air pollution, and would it be integrated into Environmental Act? Actually, within the scope of environment affairs, we have certain projects and we have certain concepts. And there are certain advocacy efforts to improve the lives of people, and they generally focus on the violations of rights, etc. And we can see that there are certain steps taken to the direction that you are telling. For the lives of all beings and for people, of course, environment practices are crucial. However, we do not see that many effort in Turkey. EGEÇEP is implementing certain activities in Ala, for example. Against radiation, against pollution, they have significant activities. But on the other hand, we do not see an environment activism in Turkey in an effective manner. What can we do with the tools that we have in our hands? Of course, you can raise awareness. 30th provision, article of Environment Act tells us that the disruptors of environment are being asked to stop their activities by public authorities upon the realization of their violation. We have certain monitoring tools, for example, in Turkey, but we have realized that there are no effective use of these tools because during the earthquake, for example, there were no tools being used at that time, and we couldn't measure anything. If we can just have measurements, we can realize possible violations, and then you can stop those activities. But then again, as I've stated, in Turkey, we do not have enough organization capacities. In Turkey, we couldn't get that capacity so far. And of course, healthcare professionals need to get organized. Another issue is that European Human Rights Court provided a verdict on Russia by saying that Russia contributes to pollution, though they are not have the authority or jurisdiction over that soil, and they are the polluters of a different and foreign soil. And it was assumed as the violation of Article 8 of ECHR. And I do assume that this will be a precedent for their air pollution verdicts in future. We may just exercise our rights in the courts. This could be a case for our country because it is already happening in different countries. So you may just go and seek for your rights, and local authorities and public institutions are needed to be warned within the light of our findings, actually, because they need to be aware of all these issues. But in Turkey, climate change is just acknowledged within the scope of environmental issues. But the representatives of political parties in Turkey needs to take a step further from this standing point. Unfortunately and very sadly, we see that the politicians do not take such steps at this point. We try to activate our tools. And if we can activate our tools, I think we can just solve the problem. I mean, there's a pipe, imagine, and you do not have any water within that pipe. So you have a tool, but it is not functioning. This is the case in Turkey. You need to integrate every single tool. You need to activate all these, and you need to refer current problems. And right now, policymakers do not associate such tools within the capacity of solving this. Unfortunately, we have exceeded our time. So please just wrap up the meeting, Çağlayan, for us, and let's conclude. I have noted two questions. One was about curricula update and change in Faculty of Medicine. We had such an effort. And last year, we have provided our findings in the Congress of Public Health because we checked which topics could be delivered by which institutions and by whom, and what is the situation across the world. Our findings revealed that in the world, nearly half of the medical faculties have somehow incorporated climate change into their curricula. And yes, there is a certain impact on public health by climate change. In Turkey, we need to do a lot of things to tackle with this issue. We see people's diseases and their relation to climate change. This is also the problem of the world. In US, in European countries, certain faculty of medicine became a member of that consortium to create a curricula which includes information about environmental impacts and health impacts of climate change. They are trying their best to provide lectures during their education and post-ed period. We have prepared a project, even climate change oriented medical education is the name of our project, by the way, but we couldn't get any support so far. So hopefully when we get, we will implement it. And hopefully we will have the opportunity to discuss climate-oriented medical education all together. Heat waves. We had a group study on this heat waves, and we tried to identify every single thing and the impacts of it. And Nurcan is here, Professor Nurcan. With her in a medical congress, actually, we have discussed the role of climate change on public health. She shared quite interesting findings. And as we have all network members here, she may inform us, though we have exceeded our time. Because she's providing education in nursing. Okay, then you may just let her use your time. Okay, I will add just one more thing. Nurcan, would you like to say something? Unfortunately, the voice is inaudible to the interpreter. She's from Department of Nursing. I am a lecturer at the Department of Public Health Nurses. With Çiğdem, we were the participants of a congress, and I tried to deliver the findings of our study. We have reached out to 70 schools. The promising thing is that schools are already aware of that situation, and they provide the information and background info for that climate crisis. What is environment, what is climate change, are the elements that they are touching upon. At this point, in certain universities, they have incorporated this topic into their curricula during their bachelor degree, and it is possible to take certain courses in master's degree. I will provide an elective course on the impacts of climate change on human health. However, these are not sufficient. a lot to do. We need to advocate for this topic, and we need to raise our voice to raise awareness. Okay, let's wrap this meeting up. Özlem. All right. There was a question by Necati in regard to our advocacy efforts. Yes, Melike provided you an answer, but I would like to add one more thing. Last year, we were in a congress in Konya about this topic, and there's Funda from here. She is such a great advocate in this topic. She was involved in the process of lawmaking for Environment Act. Can we briefly give a word to Funda? Okay, you just conclude, then we will continue with Funda, okay? I have an announcement, please. We have exceeded our time, because now we are on our lunch break. We need to have a family photo here, and then in the afternoon, starting at 2 o'clock, we will have our roundtable meeting. So, Funda, let's see you first and then have our family photo. Thank you so much for being here. And thank you so much for participating in our meeting in Konya. It was great to be with advocates. It was great to be with local authorities, and I do wish that we will come together more often and contribute to the topic. Thank you so much. Thank you to our speakers. Thank you to our international participants. Thank you, Narayan. And now I would like to invite all of you to the stage to take a family photo.